Okay, so I'm outside in our backyard right now, so I apologize for any like car noises you might hear. So this is going to be the first of a series of vlogs regarding my sex reassignment surgery. I'm going to try to, just do vlogs throughout this whole process and throughout the healing and everything. So on Thursday, I attended a sex reassignment surgery class. This was done at the Kaiser's transgender clinic in Oakland, since I get my insurance through Kaiser, and that's who's doing the paying for the surgery and everything. I attended the class once before, but I decided to go ahead and do it again. This is the last class they're offering before my surgery on December 12th. So, it was suggested that I attend to get a refresher, and I'm really glad that I did. So the surgeon who's going to be doing my surgery, Dr. Ali Salim, is going to be there. He's a Kaiser doctor, and so the surgery is being done at their hospital in San Francisco. And one of the things he had this time... So wait, I guess let me back up. So, the class basically covered, first it was Dr. Salim talking about the surgery itself, then somebody talking about aftercare, and then somebody talking about, psychological and mental health stuff. And there was somebody talking, and then we got to hear from some folks who'd had the surgery done. So anyway, so one of the things that Dr. Salim had this time is he actually had photos of the surgery results, and it's really impressive. I mean, it looks surprisingly good even just after 3 months. After 6 months, it's nothing short of amazing. And he uses the standard sort of penile inversion technique, but he does things that are a little bit different. One of the things he does that I think is really cool is when he's constructing so the clitoris is made from the head of the penis, but he also takes some of the skin in what he referred to as the circumcision area, that area right below the head of the penis where people get circumcised. And the skin from that is what gets used to make the labia minora, so you end up with sexually sensitive labia, which is friggin' awesome. And another thing he does that's really nice is the way he positions the scars. So typically, surgeons will place the scars in that space where your legs attach to your crotch, where you've got the divots, and so the scars come up in a V. Well, what he does is the scars, they come up in a V, but then they end up curving inwards. So it's like an upside down teardrop that frames the vulva. And it looks really nice. It's a very aesthetically pleasing result, which is great. And apparently it works great from a sexual standpoint. So I am super, super stoked about that. I'm really, really glad I got to see the surgery results, because sure, I can look up surgery results online, but each surgeon is going to be just a little bit different. So it was nice to see Dr. Salim's results, and yeah, he does an amazing job. Once it's all healed up, you cannot tell it apart from the real thing just by looking at it. The only way you'd be able to tell it apart is through close examination, and even then, I suspect you might not be able to tell it apart unless maybe you were a gynecologist. But honestly, most people just looking at it, they wouldn't be able to tell the difference. So yeah, that was really good. I also definitely learned some stuff. I did pick up some good ideas as to things that I should make sure to keep in mind for my aftercare. So attending that class was really, really good, and I'm super glad that Kaiser offers that, because it's really nice to just have a good idea of what you're getting yourself into. And it was really nice that that they brought in the folks who'd had the surgery done. 3 of the women they brought in had gotten it done by Dr. Salim, and they were all very, very happy with the results. So that is a good sign. So yeah, that class was super duper awesome. And one of the things that it really got me pumped up and really jazzed. So there's things I need to get done, you know, like I still have to finish cleaning up my room, and I still have more weight to lose, and I still have more aftercare supplies to purchase. And so I'm really glad that, and so having this class just really kind of jazzed me up and is helping me get motivated to get this stuff done. Because I don't have a lot of time, and I have to be off estrogen for a month before my surgery. So on November 12th, I have to stop taking estrogen. Now, the person who was the main guy at the meeting, at the presentation, he was saying that sometimes, you know, Dr. Salim will allow you to go for less time off of estrogen, and you can negotiate with that with him, which is something I think I'm going to want to do, because just being 1 day off of estrogen is enough for the dysphoria to come back. So I want to be off of estrogen as little as I possibly can get away with, because I do not want to be a full month off of estrogen. Oh my God, hell no. But I'm going to talk to him about that, and hopefully I won't have to be a month completely off of it for a month. And if I do have to be off of it for a month, well, let's just hope that things don't get crazy, and hopefully I'll still be able to get done what I need to get done. So I'm definitely going to try to get as much of it as I can done before the 12th, before I need to get off of estrogen. So, I mean, as soon as I get some more money next month on the 3rd, I'm going to be, you know, ordering a bunch of aftercare stuff on Amazon just to get it out of the way. You know, and I need to make sure my room is clean by the 12th, and get as much of my weight down as I can before then, so that way I won't have too many problems. And, oh, speaking of weight loss, the surgeon actually explained why he wants people to get to a certain weight. It's because of a layer of fat in the crotch area gets in the way when they're doing the surgery, and it doesn't allow you to get as much depth in the vagina. So it was good that he actually explained why, instead of just because I said so, or, you know, because it'll cause complications, which is kind of vague. So knowing what the actual problem is, I think is going to be really helpful in helping me stay on track, because I know exactly what the implications are. And of course, worst comes to worst, my surgery gets canceled, because part of the reason my surgery got rescheduled was because my weight wasn't down sufficiently. So I definitely need to make sure I'm on top of all of that. And so yeah, basically the whole surgery process, I'm going to be spending 6 nights in the hospital, and then for 2 to 4 days after that, I'm going to need more direct care. And it's mainly going to just be like people bringing me stuff, like bringing me food, whatever, you know, stuff like, I mean, most of the major healing is going to happen in the hospital. And before I leave the hospital, they're going to take out the catheter, take out the packing in the vagina and whatever. So the stuff that I'm going to have to do afterwards is things like dilation, which I'm going to have to do 4 times a day, you know, and showering and all that. And those are all things I should be able to do myself, because I know my mom's going to be helping out after the surgery, and I know she's not willing to help with any of that stuff, and nor do I want her to. So I should hopefully have no problems dealing with the dilation and showering and all that myself. And, you know, if I'm having some trouble walking because of the surgery, that's fine. I do actually own multiple canes, so that's not going to be an issue. So I should hopefully not have too much trouble getting around. And I'll basically just be stuck in bed a lot for a few days and just maybe spending a lot of time watching TV, spending time on Twitter, whatever. And then just, you know, text message my mom, hey, can you bring me food? So, and then of course from there it's gonna take a while to completely heal, and I'm gonna have to, you know, talk to the surgeon as to when I can start riding my bike again, when I can start lifting weights again, and all that. And 14 days after I leave the hospital, I go in for a follow-up appointment, and we can check everything out. And if necessary, I can go in for a second surgery, a labiaplasty, to correct everything. And they were saying that only about 30% of Dr. Salim's patients need to go in for the labiaplasty, which is awesome, because I was under the impression that that's pretty much how it worked. You did both surgeries. But it's good to know that I may not need both surgeries. You really only, it sounds like you only really need to go in if there's like an issue with the clitoris not being sufficiently hooded, or your urine stream is all screwed up, or whatever. So hopefully I won't need to go in for the second surgery, because that would be pretty awesome. So yeah, that's it for this vlog, and all of the vlogs are just going to be sort of off the cuff like this, shot on my phone, more than likely, just because editing videos and putting them up is kind of a pain in the ass. It's just easier to do it all from my phone. So I apologize for the less than stellar quality, but what really matters is the information. So, and I'm hopefully also going to do a vlog talking a little more in detail about the aftercare and about all the supplies I'm buying and all of this stuff. And because I just mainly wanted to talk about in this one just about the class and kind of some of the stuff they covered in the class. But yeah, it was very cool, very, very glad I attended the class, and I'm definitely really looking forward to getting my surgery on the 12th, and I really, really hope everything goes well with that. It's going to be awesome, and I cannot wait to, once all the nerves reconnect and everything is working, so I can start masturbating with appropriate genitals, because that's going to be excellent. Alrighty, I'll see you on the next one.